distinguished guests, ladies and gentlemen, Professor Yu Feng, Professor Dong Nyang Ho, Professor Liu Li Ming, Professor Meng Zhu, Professor Liu Jinping. Very good morning to all of you, and it's indeed a great honor for me to be here speaking as the AAHVD President. The AAHVD China chapter is the most active chapter in the AAHVD and has been organizing this meeting every year, one of the largest heart valve meetings. And it's so nice to see all of us here gathered here. And I'd like to thank our chapter chairs and leadership and all of you for organizing this and coming here today. The AAHVD started about 10 years ago, led by the founding president, Dr. So Hua Xiong, and it emerged from the Mulu meetings we used to hold, and this was held for the last 30 to 40 years. And gradually, the China chapter formed, and I must say it has been the most successful of all the AAHVD activities. And it is such an important meeting to have all the experts in heart valve disease gathered together, because as you know, the treatment of heart valve disease almost requires some intervention, whether surgery or newer techniques of intervention, some procedures, but it almost certainly needs some intervention for severe heart valve disease. And this has emerged over the years. We have learned newer techniques to repair heart valves, and this has progressed so much, both in degenerative and in rheumatic heart valve disease. And certainly in China, I think you have led the repair of rheumatic heart valve disease, and I think we have all learned how to repair rheumatic heart valve disease here from you in China. And so this meeting is particularly important because it is our chance to get together, to exchange our knowledge, share our experiences, and progress new ways and new techniques to treat heart valve disease. Over the recent years, of course, newer approaches to heart valve disease has emerged, minimally invasive surgical techniques, and these are important to embrace. We are essentially doing the same surgery but through newer approaches. But it is important that we ensure that when we do interventions through newer techniques, we ensure the same outcomes, the same durability of the valve repair, and the same improvement in the quality of life and survival for our patients. Of course, now transcatheter techniques have emerged, and this is now part of the armamentarium for treating heart valve disease. And again, we have to find the right sort of patients who will benefit from transcatheter heart valve interventions. But this has certainly enabled us to treat many patients who previously could not be treated for their heart valve disease. A lot of elderly patients, a lot of patients who have a lot of other comorbidities and medical problems, we can now treat through transcatheter techniques. But again, the selection of patients is important, and we have to ensure that the long-term outcomes and durability are just as good as the conventional surgery we have been able to offer. As part of the AAHVD, we discussed yesterday and over the last few weeks that we want to progress the Asian Heart Valve Registry. And I'm very pleased to announce that we are going to progress this next year, led by Professor So Hua Xiong, where we will have at least activities and early, if not late outcomes of all the heart valve procedures we do across Asia. And this is very important because we need to know the outcomes and the results of the surgery and the procedures we do. And along with this, we are planning to progress Asian consensus statements and guidelines for our patients, because the patients in Asia are different from that in Europe and the USA, and we have to have Asian guidelines tailored to our own Asian population. But to do that, we need to publish our data from across Asia. And the efforts of setting up the database and registry is part of this effort, so that we hope to produce some reports, some publications in the next few years to better guide the treatment for our patients. So thank you again to the organizers, AAHVD China chapter, and to all of you for coming. We look forward certainly to another 2 days of exciting discussions, exchange of ideas and knowledge, and building up our friendships across all countries. Thank you.